Hey, thank you everyone for joining Benefits Talk. My name is Jessica Dubois. I'm an employee benefits consultant here at Risk Strategies. If this is your first time joining, welcome. The whole purpose of Benefits Talk is to provide you with that snippet, that 30-minute overview or introduction into the solutions, the vendors, the different partners that we have and that we're implementing into employee benefit programs right now. These are the solutions everyone needs to know about, especially if you are an employer. So if you have questions throughout today's conversation, or if you want to connect with us at Risk Strategies or Northwell, please reach out afterwards or go ahead and type in your questions throughout the conversation. Now, today's topic is an exciting one. It's about going beyond the traditional insurance carrier networks and focusing on saving money on healthcare costs, as well as improving the quality of care for your employees and their families. Now, to help me out with this topic, which is direct contracting, I have two experts who are joining us. I have Managing Director and Healthcare Consultant, Josh Jeffries, and CEO of Northwell Direct, Nick Stefanizzi. Thank you for joining us.
Thanks
for having us.
Now, first, I would just want to start out, before we do some questions, I want to start out with just a quick introduction. Nick Stefanizzi, could you provide some background on kind of your role at Northwell Direct and how you, your expertise on the direct contracting side?
Sure thing. And let me just say, I appreciate the opportunity to be here and to share more about the work that we're doing in the direct contracting space. But as you said, my name is Nick Stefanizzi. I have the pleasure of serving as the CEO of Northwell Direct, which is Northwell Health's direct-to-employer business organization. And we are partnering with employers across the New York metro area and beyond to help employers find access to high-quality healthcare solutions at a lower, more sustainable price point for their employees.
Thank you. So we have Nick from the healthcare side. So he is actually on the healthcare side that is doing some of these direct contracts. Josh, can you provide an intro on your side?
Sure. So Josh Jeffries with Risk Strategies, Managing Director of the Atlantic area. So basically think the Philadelphia, New York region south, but our clients are all over the country. And we really started in the direct contract side on behalf of clients that had needs in geographic regions for access and lower cost points. And so it's an area that we've been doing about 4 years now, and it's growing very quickly in terms of helping to connect employers directly to providers at lower rates.
Thank you. Thank you for that. And we only have 30 minutes. So we have to dig into this. Josh, I'm going to start off with you. Now, in simple terms, if you can, how do you explain direct contracting to an employer?
Yeah, so direct contracting in its simplest term is just a agreed to arrangement for a price for services and access for members to specific providers or facilities directly between the employer and the provider. So you're bypassing the traditional channel of carrier networks or independent PPO networks, and you're just going straight to the source of the provider. And so in its simplest term, that's what it is. And historically, these are relationships direct from the employer to the facility. Today, they're turning into some other variations of what we call aggregator agreements, where we at Risk Strategies hold aggregator agreements that all of our clients can access and share those direct contracts amongst themselves. And so in its simplest form, that's what direct contracting is.
Now, is it only for hospitals, or are you going to individual doctors? Is it for bundled services? Can you elaborate more on that?
All of the above. So facilities is where it historically started, and it was large employers with large health systems in a specific geographic region. Today, it's morphed into all clinical categories, so durable medical equipment, primary care, specialty, labs, providers, and health systems, as Nick can describe later, own a lot of those services today. So by directly contracting with one facility, you can actually have access to all clinical categories.
I just want to, I'll add to that if it's okay, Jessica. We've built the Northwell Direct Network to encompass over 22,000 providers in the New York metro area, over 50 hospitals. We've got relationships with, to Josh's point, with DME networks and other ancillary benefit providers. And, we started, the foundation of our network was the Northwell Health employed and voluntary physicians, but we recognized quickly, in order to effectively serve employers in the New York metro area, we had to push far beyond our own traditional footprint. And so we've partnered with other health systems. It's actually been an opportunity for us to collaborate with people who may have been viewed traditionally as competitors. And we've also gone out and recruited independent practitioners, people that are not employed by health systems. So there really is opportunity in this for all different providers, different shapes and sizes of providers to participate and to serve these employers.
Now, I appreciate that, Nick. Could you tell more of why would a provider want to do this? Because think about it, they're receiving a specific amount from, the insurance carriers based off of those discounted rates that they have for services. Why would a provider want to do direct contracting with an employer?
I think there's a couple of reasons that would motivate providers to get into this space. Number one, there's a mission orientation to this work. Healthcare is inherently local. Provider organizations are embedded parts of their community. And this is another opportunity to them to get at serving the members of that community through a different channel. So there's an inherent sort of mission orientation to this work that I think resonates with providers. Number two, if you think about the traditional revenue streams of providers, they're under assault, whether it's pressure from the traditional carriers, whether it's changes in government reimbursement. Providers are looking for alternative revenue streams that can help them diversify and remain sustainable and to make the investments that are needed. And then lastly, these traditional carrier networks are incredibly broad. There's an opportunity in creating these relationships to drive more of the volume within your own institution, within your own network. And that could potentially offset the discounts that are required in order to make this an attractive alternative to employers and to provide the value proposition that would get them to move. So there really are a variety of factors, I think, that would interest and do interest provider organizations in these types of relationships.
When you mentioned kind of the pressure from both sides on that providers feel from networks and vice versa, and employers not really knowing it have kind of been seeing this over the last few years. I don't know how many providers I can count that just are no longer in a network with a carrier because they were not able to come to terms on the contract or the prices, right?
Absolutely. I mean, we've seen this play out. If you just look in the New York metro area, most of last year, Montefiore in the Bronx and into Westchester was out of network with United, which was incredibly disruptive to large swaths of the population here in the New York metro area. So it is absolutely that we see something that we see happening continually with these payers as they negotiate with different provider organizations.
Yeah. Now I want to bring this back, to you, Josh. We know direct contracting has been happening for years, but I think employers have been thinking, hey, it's only for really large companies. We hear about it, the cool stuff like Amazon's doing, Boeing, Walmart is all doing with healthcare. It's historically been really large companies that apparently have the relationships or ability to do this. But we see interest and the solutions available for even smaller mid-sized groups. What are your thoughts on that?
Yeah, I think it's been something that's changed over time. And the reason is because the traditional view of healthcare was volume-based. And so that's how we ended up with 5 national insurance carriers in the United States. They were volume-based plays. Their contracts rested upon the laurels of driving business to these health institutions. And so you had to have enough volume to interest the institutions. And so I think what's changed, like many other industries across the world with technology, is it's much easier to transact business today than it has ever been historically. And so technology has played a significant role in making direct contracting and the cost to do so much less expensive and burdensome for the providers and for employers. And so it's opened up direct contracting to that middle market employer. And it's really just having the expertise and the ability to engage in those conversations. And to many of the things that Nick pointed out, it's not just volume today, it's revenue diversity, it's engagement with the community. And I think COVID-19 probably accelerated that quite a bit with the stressors that were put on local health systems and the importance of local relationships with healthcare providers. And so I think it's a trend you're going to continue to see accelerate over the next few years, especially with all the transparency legislation that's now coming into play in earnest under, that was a Trump era mandate that came down that's just now being implemented over the next few years.
I agree 100% with what Josh just described. And I think similarly, if you think about it from the employer perspective, number one, the trend lines for many years on their benefits expense have been moving in the wrong direction, right? The double-digit year-over-year increases that have been given to them by the traditional carriers. So you already have the trend lines moving. Then you look at the financial and business disruption created by the pandemic over the last 2 years. I think it's these small and medium-sized companies that bore the brunt of that. I mean, some of those names that you rattled off didn't quite experience the financial pressures of the last 2 years. In fact, thrived because of some of the conditions. So I think for these small to medium-sized employers, the environment is now right where they're saying enough is enough. We have to try something different to try to get at this problem in a different way, because the traditional model of debating every year, how much of the increase are we going to absorb versus how much are we going to pass on to the employee, is just not sustainable.
Yeah, exactly. I think, if the insurance carrier is not going to come to an agreement at a price that makes sense, then employers, advisors, people like you have to step in and provide that solution. One thing that I want to ask you both, I think of from an employer side, they may be listening to this and saying, look, I don't want to be a healthcare company. I don't want to be talking with providers about what price we pay for claims. So I want to ask you both, if that's in the back of their head or even in the front of their mind as they're listening to this, can you talk about how difficult it is for employers to have these agreements? What type of work does it take on their side? And Josh, I'll start off with you.
Yeah, so I mentioned at Risk Strategies, we moved to what's called an aggregator agreement, where we're actually coordinating that contracting process on behalf of the client to take all of that work off of their plate and to immediately provide access to other employers that want to engage with those existing agreements without as much work. And what we found with our healthcare partners also is it relieves a lot of administrative burden on their side of having to recontract every time. And so from the employer perspective, it's really not much different than the plan that they have today, because you still have a third-party administrator that's managing and running the plan on your behalf, and that piece doesn't change. And so it's really just another avenue for innovation within the health plan. And to Nick's earlier point, that's why a lot of our clients are engaging with it, because it's a pathway to not reduce the benefits and many times improve them, to incentivize members to go to those directly contracted providers while reducing costs. And there really aren't many options in the marketplace today that can achieve those two goals in unison.
So just to recap that, like, they are not setting up the network themselves. They're basically taking advantage of the network that you and we've created, right?
Yes, and we in our practice, we target it specific to each employer, and then every subsequent employer is just benefiting from the growth of that access, provider access points over time. And so from the employer perspective, they're typically not actively involved at all in that process, other than providing us the data to know where their members are going, so that we can go out and target those providers that their membership are using. And also we used all the national data, which is I'm sure Nick will have an opinion on the quality data that's out there. Nobody agrees on quality metrics in healthcare, but we use multiple national quality metrics in addition to the contracting, because it's not all about price. It's many times about health outcomes too. And I think that piece has gotten magnified as well because of COVID-19. Everybody's much more aware of the quality of the providers that they're going to, in addition to the access and the price.
Yeah. So you're finding that data, or you're taking that data of where the employees or members are going, maybe where they're located as well, and focusing on those providers to try to get them in network, but maybe putting even extra incentives in there for the high quality providers. Maybe they're, $0 copay, or you don't have to meet your deductible. Maybe there's no deductible or no out-of-pocket costs if they go to those high quality facilities, right?
Exactly.
Yeah. And Nick, what do you have to add to that? And I know we've kind of gone off into a little tangent here, so I'll re-ask the question if you need me to.
No, I got it. And our strategy is very similar, very aligned with what Josh has described. We've built a network to be able to provide beyond adequate coverage across a broad geography, and to minimize disruption to an employer's team members. And we like to view ourselves for that network as the easy button for the employer. We handle all the negotiating and contracting with our participating providers, exactly so that the employer doesn't have to. And that structure has given us the ability to scale and, again, partner beyond just Northwell to grow and meet the needs of an employer's particular footprint. Now, we will create transparency with our TPA partners around the data and the experience and the cost. And by the way, we're committed to a far greater degree of transparency than I think we've seen, and a lot of these employers have seen from the traditional carriers. They often use a lack of transparency, in my view, to their strategic advantage versus the benefit of the employer. But where we do want to see partnership and engagement and investment of time from the employers is around the specific needs of their population, around the culture of their organization. Because what that allows us to do is to work with the providers that are participating in our network to customize care delivery programs to address those specific needs, and to do it in a way that's culturally aligned with these employers. And that, to me, is a real differentiator. You're not getting that from the traditional BUCA carriers. They're not going to spend the time and invest the energy to say a primary care visit for your workforce should look like this and should have a heavy emphasis on these topics because that's what your employees need and that's what resonates with your culture. And we've had great success implementing those kinds of curated models, particularly in primary care with organizations like Whole Foods. And it's really resonated with them, the impact that we've been able to have sitting across the table together without an intermediary, and recentering this based on the patient and the provider relationship.
I like that. Well, and we're talking about employee experience, so can we dig deeper into that? And Nick, from your perspective, or your experience, and you'd mentioned like companies like Whole Foods. What is that like from the employee experience perspective? Like, they just have like an ID card, and maybe they're incentivized to go to the direct contracts, and there's another network, or do they only have access to that, direct contract provider? What does that typically look like for you?
Employee benefits are an incredibly sensitive topic, and the way employee benefits are handled really depends in large part on the culture of an individual organization. And so our view is we have to be able to meet the employers where they are. So can we offer a full replacement, high-performing, narrow-ish network to an employer? Absolutely. Do we have alternatives that are available where we can wrap with supplemental networks beyond what's in our core? Yes, and we're willing to do so if the speed and pace of disruption is too much for an organization to digest, say, in year one. Are we willing to be a side-by-side choice so that you don't force the employees over to the new product, but maybe you incentivize it with some creative plan design choices, like things around copays and deductibles? Absolutely. So our view is, we've got to be open to meeting the employers where they are and provide them the flexibility to adopt the solution in a way that will help them realize the savings that are inherent in what we've designed, but that are also consistent with their cultural values. And then the last thing that I would sort of say here is that, our view is we want to take the friction out of the experience of healthcare. And that's something we can do in a much more targeted way by creating access to navigation programs and care management solutions that we've built specific to these employer populations that make navigating, let's be frank, a very complex healthcare system a whole heck of a lot easier. And we think that experiential benefit is really valuable. And we say, I say that with confidence because we've built these capabilities and we've used them for our own workforce. And as a Fortune 100 rated best place to work 3 years in a row, we've seen the value that it's created for our own workforce and believe strongly that there's a value prop in that experience component for these employers.
I like that. And Josh, I know you have some thoughts as well, and you've implemented quite a few of those plans that Nick had talked about where you're wrapping around like a national network. Can you talk more about that?
Yeah, it's an area that's evolved a lot over the last 3 years with the growth of direct contracting. And so we've actually created a solution in the last year with one of the national BUCA carriers. BUCA, for those who might not know, is Blue Cross, United, Cigna, and Humana. So the big 5 carriers in the country. And so now we've got the alternative to provide the high performance, narrower network access of providers in addition to a national access channel. And in some cases, they're the same plan option. And in other cases, it's a dual option where the individual has a choice to go either to the narrow solution or the broad-based solution. And that hybrid model where it could be in the same plan is a very new innovation in the marketplace. And so it's something, to Nick's earlier point, needed to happen because the culture of the organizations and of the individuals themselves are traditionally aware of the fact that they can go many places for care through PPO networks. Kaiser's the one exception, right? Kaiser is the traditional narrow network. Their national quality standards are phenomenal because of that. So to Nick's earlier point, when you've got like Northwell Health has a integrated care network, so they're sharing medical records throughout the system, there's huge value to that, to the member. And that's what Kaiser has always kind of hung their hat on. And so that's all of these pieces are intersecting in the marriage of the national traditional networks and the narrow solutions. And it's a really exciting time to watch the evolution of how providers, employers, and health plans are coming together to really try to leverage the tools that are available today in the oncoming transparency wave that is hitting us to really define new solutions to historical problems.
I like that. So to an employee, like it could look like dual plan options, or it could, really just provide more value to them. Like maybe they aren't paying anything to see these high quality providers, or maybe they get access to, like you had mentioned, some of that integration of data to be able to see all of your health records and integrated care that feels a lot better, because healthcare right now doesn't feel that great to most people. I'm sure you both have some comments on that as well.
it doesn't feel that great, and it certainly doesn't feel great when you get called on behalf of the traditional insurance company, or you get or their version of care management is the postcard in the mail every year reminding you to get your primary care visit. Our view is let's integrate those tools and resources directly into where the care is being provided. So, if you're leaving the hospital, we'll send a nurse right to the bedside. And that's one of the other advantages we have of being local is let's send a nurse to the bedside. Let's make sure not only that you have a transition of care plan baked in, but that you understand it and that it's organized and that you have a resource that you can tap into once you leave the four walls of the hospital. Let's enroll you in a gaps in care program after your primary care visit that's fully integrated, that leverages the data in the EMR from your visit, that is seamlessly handed off to one of our nurses in the gaps in care program that can do outreach on behalf of your provider, not on behalf of the insurer. So you're wondering, are they really calling me about paying my darn bill? So I think there are opportunities here with the experiential components that we can layer in, the navigation features that we can layer into this, that will make it a more pleasant experience on the one hand, but that also should drive higher engagement, which in my view, if we're more proactive, if we can get people more engaged meaningfully, that's going to yield additional incremental savings to these employers because you're going to head off acute illness that's not being handled in an earlier stage and more expensive claims down the road. So there's a real win-win there for the employer and the employee.
Yeah, and I think the engagement's a key piece. So we've got 18 centers of excellence on what we call bundled agreements nationally. So if you've got an acute condition such as cancer or an organ transplant, those are conditions where we can provide the member and many times a caretaker no cost transportation, lodging, expenses to go to that center of excellence and have that procedure done by the best surgeons in the country at those facilities. And that's a huge advantage for most members because, number one, they're facing a life-threatening condition in many cases, and they just are not experts in that space. They may not even know who the best providers are in the country. So to be able to provide, from a care management perspective, options. Here's your local facility with your local treatment options. Here's a center of excellence that treats that condition specifically that will cost you nothing out of pocket is a huge advantage to some members. And again, back to that cultural perspective, members want the choice. In many cases, they don't want to be told, but they want to be educated, and they want to be educated and provided a choice to choose the path that's best for them, because healthcare is not one size fits all.
I really like that. The last thing I want to talk about is planning ahead on the employer side. So one of and I wrote an article about this last week on LinkedIn about my concern about inflation and how, we're kind of seeing some delayed effects on healthcare. It's not hitting healthcare as much, it seems now, as I think it's going to in the next couple of years. And that's because these carriers are going to renegotiate those contracts that they have with providers. And I think they're going to include, and vice versa, where hospitals are going to want some of that money back for the talent, like having to increase prices on talent and services and supplies, all these different impacts of the pandemic. So I think as an employer side is, even if you haven't been hit with a large increase in the last couple of years, you need to think about what's going to happen in the years to come and well before you have your upcoming renewal. So I ask you both is like, how far ahead should they be educating themselves or looking at this as a solution ahead of their renewal? And I'll start off with you, Josh.
Yeah, these are solutions that should have a strategic 3 to 5 year plan associated with them. And it's a process. You build the plan to your specific needs as an organization. And so to have that long-term view is very important, especially with consumer price index and inflation at 8.5% today. Healthcare has always been higher than traditional inflation. And the staffing costs of facilities are skyrocketing because of the Great Resignation. And so all of these factors are going to combine in longer term cost escalations in the healthcare space.
Mm-hmm. So
Yeah.
you say 3 to 5 years, but if they're looking at the renewal, let's say they have a 1/1 renewal, would you recommend this is something they start, they can look at right now and well before they get that renewal increase?
For sure. Yeah, you want to start as early as possible. And with direct contracting, we like to have at least 12 months of runway before we implement a plan.
Yep. And Nick, sorry about that.
No, it's okay. I agree. Earlier is better. You want to be really comfortable and really understand exactly what's going to be provided, because as I said, this is an area that's incredibly sensitive for employers and incredibly personal for employees. But I believe all of the conditions, whether it's inflation, whether it's the rate trends that we've already seen, I just really firmly believe that the conditions are right, that we're really going to start to see an acceleration of this across the country. And I think if we as provider organizations around the country can lock arms together and create this kind of alternative and partner with the right organizations, I think we can have a transformational impact on how healthcare in this country is organized, delivered, and paid for. And I think we can add a whole heck of a lot of value to these employers and their team members. And that's really exciting.
Okay. And for both of you and everyone that's listening, Nick and Josh have had many conversations with employers and healthcare systems. So whether you have questions on either side, they are a person that you can go to and ask for advice on, help, if this is something that you're interested in looking at within your employee benefits program, or if your healthcare system and this is something you want to be ahead of the game on, or at least within the game, then this is something you can reach out on and we can assist. Now we've hit just a little 2 minutes past the 30-minute mark. But is there any last notes or thoughts that you'd both like to say?
Nick, you want to go first?
Sure. Well, again, just appreciate the opportunity to share the story. And as you said, happy to connect with anyone that's looking even just to learn more and get educated on the value that we can create. But as I said, I think there are some really progressive provider organizations around the country and some really progressive employers that can really make an impact and do something different here that'll create value. And frankly, Josh mentioned the Great Resignation and the impact it's had on the healthcare space. These employers are feeling it too. And I think the value that we can create for these employers with these innovative employee benefit designs will position these employers to win the ongoing war for talent and to become employers of choice. And again, that's just another value prop of these solutions.
Yeah, and I 100% agree with Nick on all those points. I also am very excited about the transparency regulations and their implementation over the next few years. I think consumers are thirsty for information in this cost category that has quickly over the last decade become a significant portion of their personal expense, not just from the business perspective, but from the member as well. And I think it's going to drive true understanding over time of what quality and value looks like in healthcare. And that's what I'm most excited about, because I think at that point, consumers are intelligent. They do make good decisions when they're empowered with the right information. And so employers are sitting in the perfect position to provide that to their staff members, and providers are willing participants to help enable that. And so I think the marriage of those two entities are the only entities that can significantly change the storyline around how healthcare is provided and paid for in this country. And so I agree with Nick. That's what I'm most excited about and why we dedicate so much time into this space.
That's a great way to end. Well, thank you so much for joining, both of you, as well as everyone else on here. Again, if you have questions, please reach out to any of us. We'd love to provide you more information, set up a second meeting, We're here to educate and assist you. Thank you, everyone.